Innovation and medicine go together. Innovative digital health technologies can improve and sustain access to the sexual and reproductive health and rights and doctor-patient communications.
Hello, I'm Mary Hachikian, an Executive Director and Founder of the Full Family and Health Pan-Armenian Association, one of the member associations of the International Planned Parenthood Federation European Network. Today, I have a pleasure to introduce results of our innovative project, initiated and supported by the Oxfam GB, for building digital bridges between private health providers and people facing barriers for access to sexual and reproductive health services, whether the reason is proximity, the cost, convenience, or confidentiality.
The SMS for Change project is started by our association in January 2012 in partnership with community-based organizations, Support to Communities, and the Viodzor Healthcare Foundation. The project management location is St. Mary's Family Health Center in Yerevan. This center is established and managed jointly with our implementing partner, St. Mary's Healthcare Network, which is the private company with the corporate social responsibility. The main goal of this project is improving and sustaining access for vulnerable women, men and young people living in urban and rural communities in Armenia to the sexual and reproductive health-related information, counseling and medical care through introduction of simple digital technologies. The first outcome objective is to engage private health sector to use simple and effective digital health technologies for raising public awareness on reproductive health, reproductive rights and available services, for strengthening behavior change communication between providers and target groups, follow-up of the services, monitoring efficacy of the treatment and evaluation of the outcomes, and for proper management of the complications. The next objective is to engage primary healthcare providers and key health informers to use simple and effective digital health technologies for access to information, resources, guidelines, and tools on reproductive health and reproductive rights, for improving communication between providers and the clients, follow-up of the services, monitoring efficacy of the treatment and evaluation of the outcomes, and for proper management of the complications. The third objective is to demonstrate private health sector's commitment to working on public health objectives and the rationale for franchising of the client-friendly reproductive health services and establishment of the public-private providers network. The main strategic direction is introduction to the private providers and beneficiaries of the simple digital technologies such as communication via SMS, phone call, Skype and social media, for strengthening provider-client communication and engaging the private sector to promote universal access to reproductive health needs. Our concept of removing of the digital divide basically incorporates three main intervention strategies. First one is infrastructure, that is ensuring possibility of having mobile phones and computers available that are connected to the worldwide net. The next is capacity building, that is to say developing digital literacy, the capacity and skills for use of the simple and essential digital technologies. And the last one is resource usage. This refers to motivation of people to use the technology and resources available on the web. For establishment of the basic digital health infrastructure, we started with the purchase of cheap mobile phone and SIM cards, which were distributed among primary healthcare providers and key health informants in the targeted rural communities. At the next step, SMS messages have been sent to 44 years old, 50,000 users of the mobile phones living in the capital city of Yerevan and Vayotzor, Tavush and Shirak Marzis of Armenia, including those living in the targeted rural communities. The messages included simple information about reproductive health and rights issues and available services. During 9 months of project implementation, about 2,000 recipients, this is 20%, responded to our SMS messages. The great majority of respondents acknowledge importance of this humanitarian action, but 8 individuals didn't want to receive the SMS messages on sexual and reproductive health and rights anymore because of their sensitive nature. The respondents asked questions, requested information, and asked for appointments for the counseling and medical care via phone calls, SMS, or email correspondence. There were also people who directly visited the clinic for getting free counseling, medical checkup, and health care. More than 500 beneficiaries have been provided with counseling and recommendations on variety of sexual and reproductive health and non-sexual reproductive health related issues via Skype. There were questions related to the sexuality, gender identity, pregnancy and childbirth, caregiving for children and elderly people, healthy nutrition, contraceptive use, unwanted pregnancy, abortion, drug abuse, sexually transmitted infections and HIV/AIDS, and access to the reproductive health commodities. In some cases, especially for rural people in need of integrated health care, the recommendations were provided by the team of qualified health professionals, including gynecologists, family physician, cardiologist, surgeon, and others. About 400 respondents visited the clinic and received client-friendly and affordable healthcare services, including counseling, medical checkup, investigation, outpatient health care, or referrals. Men is visiting the clinic for medical counseling at the appointment time. The gynecologist provides counseling on infertility for the visitor of St. Mary's Family Health Center reached via SMS. The peer educator volunteering at the St. Mary's Family Health Center provides counseling on basics of contraception for the adolescent girl visited the clinic in response to the SMS message. Health provider of St. Mary's Family Health Center managed complication of the self-induced abortion. The client had long-term bleeding at home and visited our clinic after communication via SMS and Skype. Dental care is provided at the St. Mary's Family Health Center to the pregnant woman who visited our clinic after communication via SMS and Skype. Laboratory diagnosis of sexually transmitted infection is provided to the clients from rural areas. Staff of the clinic is taking care of child whose mother attended for medical services following communication via SMS and Skype. Hospitality is provided for the child waiting for her mother receiving medical services at the St. Mary's Family Health Center. The St. Mary's Family Health Center is keeping electronic medical records of the clients from rural areas, which helps to follow up the cases via Skype and other digital technologies. The staff of the association and St. Mary's Family Health Center is currently piloting the clinical management information system developed under the framework of the association's programs supported by the IPPF Global Comprehensive Abortion Care Project and SAAF in partnership with the Synergy International. The clinical information management system includes also commodity logistics systems which help to ensure timely provision of reproductive health commodities, including contraceptives, to the clients in need. One of the features of the project is ensuring access to the electronic library and resources related to the sexual and reproductive health for the people who have sufficient level of the digital literacy. Computer literate people receive links to the website of the association for access to the relevant resources related to the sexual and reproductive health and rights. The web page includes electronic resources in native language, particularly book Sexual Health ABC for adolescents and young people. Medical animation on childbirth. Testimony of gynecologist of the St. Mary's Family Health Center about benefit of using digital technologies for unmarried sexually active young people. Testimony of consultant on HIV/AIDS about benefits of counseling via Skype for people at risk of infection. Testimony of midwife of St. Mary's Clinic about increase in clients' attendance after the start of SMS for Change project.
Digital technology has bridged a great gap between the healthcare provider and the patients. The patients who are not able to get medical consultation at the time of need. It has not only made medical consultation easier for the patients, but also has made medical consultation for the healthcare provider to follow up their patients in time. This has all been helpful because of the Pan-European Association for Family and Health with the support of Oxfam Europe GB.
Thus, results of this project clearly demonstrate that getting out of the closed doors of the clinic and building digital bridges between health providers and clients is contributing significantly to the healthy lifestyle, prevention and timely management of diseases, and promotion of the reproductive health and rights. The private health providers of the St. Mary's Family Health Center are committed to working on public health objectives in partnership with rural public health facilities. The franchising of the client-friendly reproductive health services and establishment of the public-private providers network might help to reduce the gaps at the country level.
Finally, I would like to acknowledge all stakeholders involved in the project design and implementation and express special thanks to the Oxfam GP for assistance and support.